When we think about glandular disease, the big risk factors are being a warm blood. Warm bloods have a much higher risk of glandular disease. We don't know whether that's a genetic thing, whether it's a genetic predisposition, or whether it's to do with the way that it's a behavioural thing, because the next thing that we see related to glandular disease is it's much more a disease of stress. So we've talked about stress and ulcers for years, but actually it's largely irrelevant for squamous disease. Squamous disease probably causes stress, but stress doesn't cause squamous disease. Whereas for glandular disease, we have a reasonable body of evidence that says that horses that are either stressier or have increased stress response or behavioural stresses are related to an increased risk of disease. And so it could be that the warm bloods are just naturally more sensitive, and they do tend to be naturally more sensitive and therefore more prone because of the sensitivity to behavioural stress. And we don't know where thoroughbreds fit in, but I think, the off-the-track thoroughbred sort of has the full spectrum. It can be as laid back and behaviourally unstressful as a cold blood, or it can be at the other end of the scale and be like a highly strung warm blood. And I think where you fit on that scale is going to have an impact. It's that behavioural response and it's that behavioural stress. So the other things that we see are things like in those horses is increased number of riders, increased number of handlers is a risk factor. It's relatively easy to think if we're a dressage horse, our whole world is about release and moving away from an aid or moving in a certain way to get the aid taken off. We change riders and you're a really well-trained dressage horse, or just looking for someone to press the button and do your thing. If the person keeps pressing the wrong button, you could very easily see how that could be behaviourally stressful for a horse. And so, changing riders on some horses or having multiple riders on some horses is going to be behaviourally stressful. Handlers is the same thing. It's this whole human-horse interaction that we, as veterinarians tend to sort of look past, but there's a real impact of that behavioural human-horse interaction. Exercise does play a role, but it's a different relationship. It's not the duration of exercise, it's the number of days we exercise per week. And so we know that horses that exercise 5, 6, 7 days per week are much greater risk of glandular disease than horses that exercise 4 or 5 days a week or less, irrespective of the intensity and duration. It's the number of days. Probably looked at another way, it's the absence of rest days. And so one of the cornerstone recommendations we have for glandular disease is to build in at least 2 and ideally 3 complete rest days per week into the horse's schedule to reduce the risk of glandular disease. The next thing we look at is the potential of concurrent things like orthopedic pain, saddle pain, back pain, being contributors to behavioural stress and to potentially worsen, the risk of glandular disease. So we always want to make sure we treat the whole horse and not just the stomach of the horse, particularly when we're managing sport horse populations. And then the last thing, which is we don't have a lot of evidence for, but I'm personally a big believer in, is how we manage horses. And one of the things we know about horses is they'll put up with just about anything if they have a friend, if they have companionship and a stable buddy or a pasture buddy. Their tolerance for adverse interventions is so much higher. Having horses pastured together, and then we get really into dangerous territory when we say we should take their rugs off and we should allow them to mutually groom and engage in normal behaviour. But for me, I think that they're really important things for horse welfare overall, and I think that they're things that will make a difference overall to our risk of glandular disease in a population.